Melissa. Almost Anything, where we talk about your life and your body, where we believe your health care is your responsibility, that you have a choice in where you spend your healthcare dollars. But most importantly, where we believe pain is not normal. I'm your host, Melissa, with Nephew Physical Therapy. Today, we talk about vertigo, dizziness, spinning, nausea, just outright uncomfortable, terrifying episodes of vertigo. It's been 10 years since Joan Cruzy and I, one of our other therapists, ventured out on an adventure to learn more about how to treat people with vertigo. Yes, skilled physical therapists treat vertigo. Why? We're anatomy experts, and your vestibular system, your inner ear, your balance is connected to your anatomy and movement. It's why if you've ever had that acute episode of vertigo, you don't want to move. So let's start with this. Let's start talking a little bit about the anatomy. All right. And if you're joining us, please, if you have some vertigo questions, put them in the chat. We'll be sure to answer them in the middle of our broadcast today. So let's talk about that acute episode of vertigo. The long term, and I'll say this very, very slowly, is benign positional proximal vertigo. What it simply means, and if you've heard of this before, is the crystal in the wrong part of the ear. So your ear has three canals: horizontal, anterior, posterior. These canals, which are very tiny, I mean much smaller than your ear, because they're deep down inside your ear, have little tiny cilia that move through, fluid moves through, which helps you feel balanced. Okay, that fluid adjusts, the cilia adjusts to allow you to feel level and balanced at any particular time in life. However, if one of these little crystals that are supposed to be in one part of the ear end up in one of these canals and sits on that little cilia that's supposed to be moving that fluid, well, all hell can break loose, let's be honest. And it is sudden, it is horrible. We have had many, many patients and clients over the years that think that they're having a heart attack or a stroke and end up in the emergency room because it's so sudden, it's so scary, you think you're dying. So this sudden onset of vertigo, again, can be caused for a variety of different reasons, right? It can be that crystal in the wrong part of the ear. What we do often see, though, even more so than you would think that scenario, is issues due to long-term kind of or a recent episode of a virus of some kind. And so when you think about the connection anatomically of your ears, nose, and throat, they're all kind of interconnected. That's right? When you have a runny nose, your throat hurts. When all of those things get irritated, that again can cause abnormal pressure and affects the balance of the inner ear. So when we're treating vertigo, okay, when we are treating somebody who has had an acute bout of vertigo, or let's be honest, people who've had vertigo for decades, we want to start out with determining whether or not you get nystagmus. Okay, so nystagmus is this crazy eye twitching that happens. You'll know it because it's probably when you're spinning and spinning and spinning. So we're trying to identify if that's actually the cause of your vertigo. So we're looking to differentiate between the inner ear and, to be honest, the neck. Having done this for a decade now, we have realized there is a significant correlation between neck issues and people who have dizziness. Think about that. So if you, in fact, have suffered from vertigo on and off, so you consider it more like a lifelong condition, okay, not a sudden and an acute bout, which I'll tell you a story about somebody that we saw recently with an acute case of vertigo. But somebody that you have it on and off, what we find is there's a loss of motion in the neck. So the question is, chicken or egg? What came first? If you think about how your neck needs to move, we need to have full motion and rotation to the left, to the right. We need to side bend, and we need to look up. We need all of that motion. If the neck stops moving, because of a disc issue, because of poor posture, because of muscle tension, because of any of those things, we can't move as far. Well, when we can't move as far, again, go back to those horizontal canals with that fluid that needs to whoosh through, right? It needs to be able to tolerate this kind of motion without feeling like you're going to fall over. Think about the swings at Dutch Village. Are you excited to ride them or petrified? Okay. Do you ride it and you love it, you get off of it and you want to puke? That is a way to tell how well you handle all that extra force and motion in the inner ear, okay? Because we need that fluid to move well, all right? So we're looking to differentiate, again, between one of the things we're looking at is the neck the cause of it, because you just don't move far enough, and so you're always running into the end, and you're not challenging it. I often use this phrase called vestibular weakness. And I once read this great article by an occupational therapist, I think out of the UK, that was really talking about kids. So when we think about our kids, we maybe more so than our kids do, merry-go-rounds, the swings, duck, duck, goose, tag, all of these things with quick, sudden stops, movements, circular motion, all those things. They are actually vestibularly strong because that inner ear can handle all that fluid moving through those canals, all that cilia that's moving through there, which is great. What happens is we often move less as we get older, not necessarily because of aches and pains. And of course, remember, we don't buy into that myth, right? That pain naturally comes with getting older, but we do often move less. A lot of us, as we progress through our careers, I've said this many times before, as we progress through our careers, we move more to an office position. I spend a lot more time behind the computer now doing administrative work than I do hands-on treating clients. And so therefore, I am not challenging my body as much. And so the intentional movement, the families that I see that are running up and down the dunes, that are out swimming and riding bikes and going on hikes, the more active and more motion we continue with, the stronger our vestibular system is. Boat riding, okay? There are people who are vestibularly weak that suffer from car sickness, don't tolerate boat rides well, all of those kind of things. The question would be, is it connected to their inner ear? Is it connected to loss of neck motion? And can we make it better? Here's what I've learned over the last 10 years of doing vertigo related issues is we correct or we fix dizziness by making you dizzy. And every time you say that to a client, I think there is fear and panic that shows up on their face, because not only do we need to make you probably dizzy to test it, to figure out if it's the right ear, the left ear, but we're going to need to desensitize you and get your body used to that much motion again. And it doesn't just go from I can't move to I can move again. You have to slowly work your way back to it. So what we do though, and think about this, okay? So if you don't want to shake your head no, or you don't want to shake your head yes, because it makes you feel dizzy, here's a practical tip right here. What we start out doing is we don't go 100 miles an hour, okay? We focus on our vision, focusing on a spot, and we do some intentional yes or no motions over a designated period of time. Now, if you come in and your vertigo is at a 6 or 7, okay, it's fairly high in the scale. My goal isn't to push you to a 12, which doesn't exist, right? But our goal is, right, like at the worst you're a 7 or 8 today, you're at a 2. I want to push you to maybe a 3 or 4. I want to irritate it a little bit so that you get used to that much motion at that speed, okay? However, it's not comfortable. It's not fun. It's not enjoyable. However, when we think about building muscle strength, that's not always enjoyable either, right? We have to push ourselves into a position of being uncomfortable when it comes to making progress, okay? So we combine things like head motion, we combine vision. That head motion makes the vestibular system, engage. And then lastly, musculoskeletal system, which is your balance. So you really need all three things to be working: your inner ear, your vision, and your whole body when it comes to feeling balanced and level, okay? So we address all of those things together to determine which is the most problematic. And it's interesting to see that some people who have vertigo or vestibular issues also have balance issues, which may not be due to the inner ear. It may be due to a bad knee, a bad hip, weak back, those kind of things. So that's kind of the stuff that we're looking at, we're treating, we're addressing on a case-by-case basis. Now, one of our best case scenarios is the one and done or two and done. Now, it depends on the individual. And the reason we're not actually a one and done clinic when it comes to vertigo is because the follow through and the follow up is really important. And while, yes, we want you to do stuff at home, and yes, you need to be doing your homework, we want to make sure that you are clear, right, of that vertigo, of that haze, of whatever it is that you're feeling. So just this summer, we had an interesting call come into our office where some out-of-towners, like East Coast out-of-towners, were in Michigan vacationing, and the wife woke up in the RV spinning out of control. Like, didn't want to move, horrible, horrible vertigo, sudden, no reason, whatever. So they started calling all around the Holland area to see if somebody could get them in that day. I was here, we were able to get them in. Here's what we found. We were able to differentiate one side from the other. But the one thing that they did, which was pretty amazing on their part, is the husband had previously been to physical therapy and had had vertigo. And so they were familiar with one of the maneuvers we do to clear the crystal. And they gave it a shot at home or in the camper, right? And she did not feel well when she did it. But we got them in. And when I saw them by that afternoon, she was actually significantly better. So what they had done is they had gotten that crystal, which was probably in the inner part of the ear, about halfway through. Because one of the challenges of doing the Epley maneuver or the rollover maneuver, people Google all this stuff all the time, is the challenge is, one, when you do it to yourself, you're afraid. And you're probably not going to go fast enough or far enough. Okay. And so when we take you through that maneuver, we're guiding your head, I'm protecting you, I'm taking you off the edge of the table, and I'm intentionally waiting. I'm also making you do things like keep your eyes open, which, believe me, nobody wants to do when they're dizzy. And so when I did this maneuver on her, no symptoms in the first position, no symptoms in the second position. But when I got her to do a full body roll, there we went. But not to the extent that it had in the morning. And so I give these clients of ours so much credit because what they did is they gave it a shot. They tried, which I totally commend that. And even better, they got in to see us. And so we were able to, I did the full maneuver with enough speed and accuracy, which are things that we provide, that skill, and then sent her home with some exercises. Now, again, they were out of town. I wasn't sure if I was going to ever see them again. And one of the things that I can tell you that Joan and I try to do with our vestibular patients is just kind of depends on what they need. Sometimes it's a neck and a vertigo issue, which we have somebody right now, and we're treating that 2 times a week, probably for the next 4 to 6 weeks because they are holding hands. And the neck needs to get fixed and the vertigo needs to get fixed. But in some of these scenarios, we're treating them, we're sending them home, and instead of scheduling a follow-up, sometimes it's a text or a call. In this particular situation, texted the next day, it was so great. The husband goes, oh, we're at Captain Sunday enjoying ice cream and we feel great. Well, praise the Lord. Like, that's awesome. That's what we're looking for. And they were able to continue on their vacation. Whether or not I will ever see them ever again, the Lord only knows. But we were able to make a difference. And what they did, which is why she's feeling so much better, is they jumped on it right away. We proactively treated it. Yes, there's a tendency to want to stop moving. There is a tendency to want to take medicine to make it feel better. But based on our experience, the more you move intentionally, and as soon as you can get to a skilled physical therapist that can differentiate right, left, because a lot of times individuals don't know, they just feel awful whatever they do, we can figure out if it's up or down, right or left, and then look into other issues that may or may not be causing that. So that's our job, is to dig a little bit deeper. Yes, the internet, right, has all kinds of things that you can try to do yourself, but of course it's scary. And when a friend calls me or a family member calls me from the other side of the country and says, I have vertigo, what do? I was like, well, I know what you should do, but you're not going to want to do it because it's really scary. And that's where when I get to actually hold their hands, right? They're hanging onto me as I am taking their head off the edge of the table as fast as they'll let me go so that I can really clear that crystal out of that canal. The faster I can do it, the more intentional I can do it, the safer I can do it, the faster you feel better. You know, it really is frustrating to me as a physical therapist when I read Facebook posts by my Facebook friends and family that somebody's missed a whole week of work because of vertigo, that they're stuck in bed, that they're not feeling well, they're afraid to move, and eventually they feel well enough to return to life. And I know one of the challenges always when it comes to doing anything with our health is the cost associated with it. And I continue to address that point as we have these weekly chats and as you bring your questions to us, because a full week of work, whether you get to use vacation time or not, right, we know is very costly. But what if, as in many of the scenarios we've had, you get to do therapy twice, once, right? We're talking a few $100s or less, depending on your insurance coverage. A couple $100 to be able to continue to live your life, okay? Let us help you solve that problem. I guess I just don't often understand our culture and maybe, you know, there are things in my life I'm not addressing either. So you feel free to point your fingers back at me when it comes to taking care of our physical health. But really, when people are suffering, it's hard because I want to help people. And it's not that I'm not willing to tell you. I can show you the exercises that you can do. Problem is, we need a guide to take us through the journey to get to resolution. There's a reason why I call my friend Carla when I've screwed up my QuickBooks payroll, because she is an expert and she will guide me through. I need people to guide me through different areas of my life that I am weak in, that I'm not an expert in. And that's what we want to do. We want to come alongside of you. You're going to have to do the work. Physical therapy, as I like to say, we will physically work on you and you will physically have to work yourself. And that's really where the progress is the follow-up, is the homework, is all those kind of things. And vertigo is not unlike back pain, neck pain, knee pain, plantar fasciitis, any of those issues. It just takes commitment, time, and energy for us to resolve those issues. Now, there are for sure issues like veneers that cannot be corrected with physical therapy. There are inner ear diseases that do not get fixed with what we do. On occasion, somebody with Meniere's disease can have an acute bout of vertigo, again, that BPPV we talked about earlier, and yes, we can treat that and send you back on your way. But the key here is that most people who have these sudden onsets of dizziness, vertigo, spinning, name your symptom, nausea, need some specific treatment to allow us to get you literally back on your feet. And it really does bring us great joy because you need to be moving well. So we talked about a couple of different things today. One, you need to be vestibularly strong. So you need to be out moving. Go for walks and turn your head and scan. Jump on the trampoline with the kids. Ride the merry-go-round. We shouldn't outlaw those things on kids' playgrounds. Ride the merry-go-round. Do the swings. Ride the roller coasters. Ride the swings at Dutch Village. Do those things. Go on boat rides. Do all these things. Keep it. You know, it is a lose it or use it part of our body. So keep moving, keep spinning, keep turning your head, because it's no fun when you're driving down the road and you go to check your blind spot and you start spinning. That's scary. That's scary right there. So we can prevent that. Okay? Dizziness in many situations can be preventable. If you have an acute bout of physical therapy, if you're in West Michigan, get in to see Joan or I. If you're in another part of the country, find a clinic that really has good experience and hands-on care when it comes to how they treat vertigo and do they do follow-up care. Not a one and done, but if I need more treatment than just an Epley maneuver or a cannulus repositioning, to use some of the technical terms, do they do follow-up care? Do we check that? And let me tell you, some of these scenarios that we get, which are, so that's the acute thing. The third thing is these long-term conditions, these weird post-concussive stuff. People who've had concussions, head injuries, neck stuff. If you want to be amazed, you come watch Joe take somebody through this kind of balanced vestibular world where you couldn't recreate it unless you recorded it, with cones and magazines and glasses, sunglasses with Vaseline rubbed on it. All these things to distort and challenge your vestibular system, because it can be made stronger and we can correct for it. Because if you love to ski, if you love, I'm trying to think, if you want to travel, if you want to road trip, all these things, if you want to do that and dizziness and vertigo is getting in your way, it's not normal. Shouldn't be living with it. So stay active. That's my piece of advice. Keep moving your head. If you have neck issues, get them resolved, friends. Don't let it turn into surgery. Address that early. And then if you do end up with an acute bout of vertigo, get help. Ask for it. You can be vestibularly strong. You can avoid those things. It should not be a lifelong diagnosis. And no matter the age, we can improve head motion, balance, the connection between our vision, ear, and our bodies. Those things can improve. It's just going to take some work. Thanks so much for joining us today as we have talked about all things vertigo. If you have future questions and you're joining us on the recording, feel free to put them in the chat, DM us, personal message us. We'd be happy to spend some time answering your questions specifically through text, and or we can do a pop-up video specifically to address your concern. Or if you're interested in doing some physical therapy here at Nephew Physical Therapy, no referral needed. We'll look into your insurance. Just call the front desk, talk to Rhonda. She'll guide you through all those steps. If you have specific questions, again, send them here, send them to me. I'd be happy to guide you and give you some information and maybe give you the tools that you need so that you can feel well. So, as always, remember, pain is not normal. Vertigo is not normal. Do something about it.